conversation. And we hope it's the start of a conversation. And we wanted to share some of the work that we've already got underway in Weymouth and Portland. Tell you a little bit about our teams, who they are, how can you make contact, what we do for children and families, talk a little bit about our aspirations, and share some of our concerns and worries, and potentially think about what is it we could do together to address some of those concerns and worries as well, because we know that we haven't got everything right or everything in place. So a real honest conversation, I think, from us, and a start of a conversation, I hope, that will take us a little bit forward. I'm going to talk a little bit about our Children and Young People's Plan that's already there, and then hand over to Amanda. So if we move to the next slide, Amanda, which would be helpful. Amanda, do you want to talk a little bit about what we're planning to do around Change for a Generation, and then we can move into what we've already got in place?
Yeah, absolutely. So I think it speaks for itself there, the wonderful image of our place right there, and our aspiration really to think long term, to think of the child who's born today, looking back when they're an adult and saying, do you know, I was really, really fortunate. I grew up in Weymouth where people really cared about me. I really belonged in that place. And you know, everything was done to make my life wonderful. And, you know, just hearing the people who are here today, I think that's a shared aspiration. So we're going to talk to you about, you know, how we're setting that stall out really, and really having long-term vision for our children and with our children.
So our children's plan, and it was really interesting to sit and listen to your priorities that you've been talking about this morning, because quite a lot of the priorities in our children's and young people's plan, they've come forward and said these are the things that are important to them too. So in writing our Children and Young People's Plan, which is a partnership plan, and we have key statutory agencies around the table, and involvement of the community and voluntary sector, as well as our schools, our police colleagues and others, thinking through what is it we can do together. And we came up with sort of 6 priorities. When we started the work, and before we started working with children and young people, we had 5 priorities. We didn't have the 6th one. And our children and young people's feedback and all the work that we were doing asked us to include a priority about Dorset being the best place to live. And for them, what being the best place to live looked like was one that took environmental concerns really, really seriously. So lovely to hear from Penny what was happening. One where they felt included. So Jo, from you, that was one of their priorities that they had brought forward. And having places and spaces to do things with their friends and to feel safe in their communities. And they don't always. And I'm going to talk a little bit more about that a little bit later on, about feeling safe and what that means for our children and young people. But best start in life, real big priority for us around how do we get it right for our babies, and how do we get it right for our young parents and our other parents, to do as best as they can and get those sort of first 2 years of life really, really right, and then making sure that our children are ready for school and ready to learn and all the things that means. So a big piece of work for us in there is thinking through how can we make sure maternity services, health visiting services and our services all line up. And we've got some work happening around parents who've had multiple children removed and how we can support them better in the future so that doesn't happen again. But thinking through what are our children's centre offer look like, how can we make sure that we help children acquire language in a way that meets their needs, because we know that those lasting foundations make a real difference. So within Best Start in Life, we're thinking through parent and toddler groups, we're thinking children's centre activities, and we're thinking some of those real complex needs as well. Ensuring that our children are young and thriving. So within our young and thriving priority, we're thinking through having jobs for the future, for our young people with special educational needs and disabilities, that they're prepared for adulthood and that they have access to work, because not enough of our children and young people with special educational needs and disabilities go on to be able to access good, meaningful lives and employment, and then help them stay in our communities. Within Young and Thriving, Alan, you'll be pleased to know we have our priorities around young carers and making sure that we get that right and support them well. And then thinking through emotional well-being and mental health. And I'm going to talk a little bit more about some of our worries in that area a little bit later on. Good care provision, really important for us and really important for Weymouth and Portland. So when children can't live in their families, when that's not safe, we want to make sure that we have enough places and homes for them to live in. So that might be temporarily. They might need to come into foster care or into residential children's care for a short period of time. But for some children, they never get the chance to go home. We want to be able to find forever homes in their local communities. And for too many of our children in Weymouth and Portland, that has meant leaving their friends, their communities, and their connections in schools to go elsewhere because we haven't had enough provision. So we've been doing a lot of work on trying to grow our provision in Weymouth and Portland, and we've got a new build children's home being built in Dorchester Road, which will have 5 beds there, plus another 3. And we've also been working on affordable homes for children leaving our care. So looking over at Kirtleton Avenue for a place for our children, our care leavers to live there as well. But it's not enough. We've got more to do around trying to get more foster carers for our children. And I think it's something that we might want to talk together about. How can we do something around that? Best education for all. So a big priority for us is making sure that our schools are as good as they can be and delivering good academic outcomes. But more than that, that they're places where children feel that they can belong. So we've been doing a lot of work with our schools about being more inclusive, about trying to keep children close, keep children in school when they can. But when they do need special schools or other things, that we have enough places for them as well. And we haven't historically had enough of that. So the council's invested quite a lot of money in trying to build places. We've bought a new school up in North Dorset, which is going to be a new special school, but we're also investing quite a lot of money in building more special school places around the country and working with the Regional Schools Commissioner around how can we get more special educational places. And there is some news for Weymouth and Portland, which will be released quite soon around more special school places in the area. So it's embargoed at the moment, but it is going to be quite exciting for Weymouth and Portland that there'll be more special school places here, which means our children don't have to get bussed out and go elsewhere, which is great. Amanda will talk about delivering locally in more detail because it's one of the biggest priorities for us and probably one for you. And best place to live, as I discussed, is about sense of belonging, making sure that we do as much as we can around the environment and that our children and young people have pride in where they live and feel safe. So I'm going to hand over to Amanda, who's going to talk more about delivering locally and what we're doing.
Thanks, Claire. So this is a really simple diagram that really betrays the complexity that sits within, but it's beautifully simple in that our children, young people and families are at the centre of all we do, at the very heart of what we're trying to achieve. So Children's Services went through a massive transformation programme so that we, as Claire described, we set out our plan and our vision for children, young people, and we reorganised ourselves really around a different way, a completely different way of working, so that we're thinking in the way of these children in this place and really recognising that our children in Weymouth Portland have a unique experience by virtue of living in this wonderful place that might be quite unique and different to a child, say, living in Blandford Forum, or, you know, there's something about the context of this place. And so we brought our teams together in Children's Services and lots of expertise. And Claire's heard me say this a couple of times this week. It's interesting, Ros, you know, you talk about repair, and I'm really a big fan of the lovely television programme, The Repair Shop. And it's really made me reflect on how we work in Children's Services, in that we listen to people's stories just as they do on The Repair Shop, and they're bringing something they cherish and love to that place and saying, please help me repair some harm, please help me restore, whether that's restore faith, restore love. And it's kind of what we do in Children's Services. We do that by really listening to our children, young people and the families they live in, really understanding their story and their lived experiences, and then wrapping around that with all this expertise in the team, So I'm so privileged to sit in that lovely white circle, trying to hold all this wonderful expertise together. So the expertise of our educational psychology team, who can understand about trauma and trauma-informed practice for children and evidence-based practice for our children with special educational needs, and also playing a really key role with us at the moment about understanding the psychological experiences that children are having in relation to the current context of pandemic and the last year, how they relate to their education, and how we as a team can build our resilience and support the resilience and hope for our children, young people. So a really wonderful part of our team. You can also see there the word permanence, and Claire talked a little bit about this. So what we mean by permanence is our social care team who enable our children who perhaps aren't living with their family because of safety reasons, who need a sense of permanence. That's our team in social care sitting in Weymouth and Portland for our children here, who develop permanence plans for those children, forever homes, whatever that looks like, or it might be enabling children back to their families in a safe way. We also have other social care teams in our locality team. So our social workers and their managers leading on children in need plans with our families, really understanding when things perhaps aren't very safe and we need to work with the family to ensure things can get better for them and their children, and making safety, creating safety with our families for our children, as well as child protection plans as well. So working across agencies to really safeguard our children, and all of the while listening to their views and working alongside them. So that's our social care team. And then we also have our education team sitting in this place. So focused around the early years providers and schools and colleges in Weymouth and Portland, and our special schools too. And really, really trying to get that best education for all, as Claire described, working right alongside our school leaders and our school colleagues to help children feel that sense of belonging, really creating safety in school, helping our schools to understand what great practice looks like, and listening to them very carefully and their experiences, but most of all listening to our children, young people, so that they have a love of learning, really. And I'll come on to that again soon. As part of that education team, I talked about the senior educational psychologist and the educational psychology team. We also have some specialist teachers who can provide, build capacity really in our schools to really help teachers who are supporting children with unique and special needs to really get the best from those pupils and offer the best education. So delighted to have those alongside us too. And we also have our early help team. So sitting across the inclusion piece, our children with special educational needs, we really invest in our locality team in early help. And early help really, I'll talk about it more, is a way of being as much as it's a service. And I will sort of talk about what the offer looks like in early help in a moment. But it's that getting alongside a family before things get really, really difficult to manage, and listening now and drawing on sort of community assets, linking to people like yourselves and all the wonderful things that are happening in the community to make sure our families can, access the local support they need in this place. You'll also see up there, we talked about education. We talked about our lovely children who may have some special educational needs. So we have a team that's committed to supporting those children, supporting schools to meet their needs, and early years providers and the community really to support those needs. But also where a child might need a dedicated education, health and care plan, working across the system with our statutory partners to create that plan alongside the parents and the child. And finally, our education challenge leads, well, they provide sort of challenge, exactly what it says on the tin, really, challenge to our education providers, supporting our schools to be the best they can be with their expertise. So a really wonderful team, and we've left obviously the contact details of the team on the left there, and I put my details in the chat for you today. So that locality model, what are the principles that guide us, if you like? What are the things that we all agree on that will make this model work? And this links closely to the plan that Claire described that we developed with children, young people and families. So as I said, children and families first, last and always too. So right at the heart of everything we do. Trying to get it right first time. So really listening, trying to get the right level of support for families, providing early help, and much more. We've invested in our early help so that we're listening to families early on and saying, okay, let's support now, and who else needs to be alongside us to help you right now. To do that, obviously, we need to make sure the services and local services are easy to access for our families. So thinking through accessibility, working with people like yourself and community partners, listening to families' experiences, and linking in to A, what works, and B, how it works. So how, really understanding how our families want to and need to access services and building that around those needs. And providing good quality and efficient services, you'd expect us to have that priority. So that real, reducing kind of bureaucracy for folk, reducing kind of handoffs of team, well, that's not me, that's this team over there, but working as one team. So that's our constant endeavour. And we do have a wonderful, wonderful workforce. You've just heard about many of them there who are in the team. So, of course, if we want the best for our residents, which we absolutely do, we need the best, confident, capable, and brilliant workforce that we have. So really investing in our workforce to continuously develop and help our workforce really to meet the flexing demands and ever-changing context that our children and families are experiencing. And again, you'd expect us to measure success so that we're really keeping a watchful eye on what we're doing well, how this translates to children's experiences. So that's the best way to measure success, isn't it? But also a constant attention really to key performance indicators and data telling us the stories, but most of all listening to our children's lived experiences about how good our services are. So I said I would talk a little bit about our early help model. So every locality has an early help team, and Weymouth and Portland, we have our wonderful early help team sitting right across the education and early help piece. This is managed through the Early Help Hub, you'll see on the left there. So if a family feels they would want a little bit of extra support, or you as a community member, or perhaps a school or an early years setting thinks, actually, I think I can see that this family need a bit of help and just not quite sure where to go, they might make contact with our Early Help Hub. So it's one central number, and the Early Help Hub has our early help family workers sitting there and our family advisors ready to listen and understand the issues that family's facing, and through that listening really will help sort of that right service at the right time that I talked about, getting it right first time. So the offer then from that point could be that we offer on the spot information, advice and guidance in that call, or to the professional already working with the family. We might support that if it's a professional who's phoned us, or indeed a family member. We might support and saying, bringing people together around the family. And our family advisors are great at offering direct support. So it might be, for example, a family is needing support to access some benefits, or doesn't understand where they can go for a specific piece of help in the community. And our family advisors are linked really closely to some of the initiatives that you've been talking about today. So I'm taking away lots from today to help them, and really able to link our families and connect them to local services. We also, in our early help teams, provide group work. We know the benefit of group work, the evidence base behind really effective group work. So where we're bringing cohorts of children, young people, parents and carers together, that might be through some toddler groups, it might be through some parenting work that we'll do with our families. And we know that we draw on evidence-based practice such as social learning theory, where we know that the answers lie in the community and in the people themselves, and by bringing people together, that kind of collaborative problem solving that takes place in a group dynamic. So we have those targeted groups really for people who want to attend, but also part of that is understanding what group work, what community work already exists that we can strengthen or get alongside, and hear more about and direct our families to. We may also provide family work, so that's where our family workers may work with a family, often in the family home, really understanding for them their lived experiences, and really building a plan with that family to try and help get things better. And often that will involve pulling a kind of team around that family, if you like, of people, community partners, it may be school, people who can really leave a change for families. So where they're struggling with certain issues, some of the issues we've kind of heard about today, our family workers will really listen hard, really understand what those lived experiences are, as I've said, and build a plan with the family. And we also provide constant link work. So that's where we link to our earlier providers and our schools and colleges, and really talk to our education providers about who might need help now, that really proactive conversation. So we may have we use a data set, for example, and we talk to schools about who do you feel may need some help now. Let's not let things get any worse for this child, but what can we do now to support this child and make things better for them and their family? So that's a really important proactive piece of work for us, and it's really highly regarded by our schools. And we may provide advice as well, so that constant kind of capacity building in a school. We may also use that work to influence our group work, for example. So we may use that to think, okay, let's develop a piece here with this school where children already are, and develop a piece of work in the school with the children. So a really wide range of support in our early help offer, and happy to take any questions on that as we move through. And then part of our delivering locally approach is that we pull together people like yourselves, people who have a vested interest and a passion to create the best conditions for our children, and share those aspirations for us for that generational change in Weymouth. So we have two alliances, local alliance groups in Weymouth, one in Weymouth and one in Portland. The Portland Local Alliance Group is very new and is ever growing, and we're very excited about that. And both local alliances came together, drawing on the Children and Young People's Plan. We've listened to young people directly and pulled in lots of what they've told us about their lives in Weymouth and in Portland. And we've agreed with them really, and with each other, what we feel we want to achieve for our children. So good health, so thinking of emotional well-being, as you would expect, as well as physical health, and financial well-being for our families. So Claire's going to talk a little bit later about some of the worries our children and families have shared with us about making ends meet. We wanted to, this was one we loved reframing together. So aspirational, what does it mean to be aspirational and have great academic attainment? What that means is a love of learning, isn't it, from day one? So we really want to inspire a love of learning. in our families and our children. So working across the partnership and across the alliance with people like family learning, our schools and colleges and early years settings, to really understand how do we create that love of learning? What does that look like? And really thinking through belonging, and how we listen to our children to create the conditions where they can love and enjoy every element of learning in their lives. And finally, we've touched on this a little bit already in our discussions today, but we really want to create good relationships. So you can see these are really sort of high level aspirations, but underneath these high level aspirations are plans developing locally, drawing on Weymouth and Portland, and what it is to be in this place. And by good relationships, we mean right across the piece. So in family homes, helping families to navigate conflict and manage it well. Good relationships with adults in the community. And our young people told us loud and clear, we really love having emotionally available adults in our lives. And sometimes we want adults to understand us better and not kind of roll their eyes when we come along, but actually embrace us and understand us and talk to us. They really want intergenerational opportunities, they told us. So that's what we mean by good relationships, really thinking broadly there. So I'm going to hand over to Claire now, who's going to describe some of the things we're a little bit worried about in Weymouth and Portland, and maybe think through those worries with you.
Thanks, Amanda. Really, really helpful. So Amanda started talking about aspirations for our children. We are worried about social mobility, in particular for Weymouth and Portland. So Weymouth and Portland has some of the worst social mobility in the country. So I think we're bottom third from the bottom around social mobility, and some of that's linked to coastal communities, some of it's linked to the quality of our education and the attainment in schools, and some of it's linked to aspirations for our children. And we don't want that to be Weymouth and Portland's story. So we really want to think through what can we do together to make a difference. And I know that that's top sort of front and center some of the work that Di's leading on from a Stronger Neighbourhoods point of view, but we're worried about that. There's no reason that our children from Weymouth and Portland should have some of the lowest social mobility, and we know that there's some structural things that we need to do that are quite big, that's going to take all partners, and then there's some small things that we can do together so we can make that heard. And we're not sure that people in the community know that. We're not sure that people in the community understand how low that social mobility is and whether or not we're sharing that information well. We're worried about poverty and we're worried about financial hardship. We're really worried about the reduction in universal credit for our families and what that means. We're worried about the cost of fuel. And I know that you've got some work that you've already done around food security. We worry about that for our children and young people. And we have some short-term projects in place and some short-term funding that's come through from the government, but it's not sustainable. So we have some work around fuel grants that will be able to help people through crisis situations through this winter, but that's not long term, that's not sustainable. So we're really thoughtful about how we can do better, and we know that Weymouth and Portland's affected more than other areas in the county, so we want to do better there. We're worried about meaningful apprenticeships and job opportunities, and we know that that links a little to some of our aspirations for our children, but we worry about relying on tourism as an opportunity and what that means, and whether or not we've got real meaningful work with training for our young people that don't want to do academic work or don't want to go to university. And for too many of our children, young people, they leave Weymouth and Portland because that's where the opportunities are. So we're still worried about that and thinking through how can we make that better. We're worried about our babies and the impact of the pandemic in particular. So through the pandemic, there has been more unintentional injuries to children and more intentional harm. Stressors in the family have been quite significant. That's a national problem, but we're also seeing it play out here. We're worried about how we can make sure that we can do some of that catching up, some of that socialization that children may have missed out on. Babies that haven't mixed with other children for quite a long time. So how can we get some of that group work back up? How can we help our babies and our children to be prepared for school, and how can we do some of that catch up and talking. So we're really thinking about how we can do some of that together, and what does it mean to be welcome in the community, and how can we welcome our children back out to play and to be around while people are worried about the pandemic and worried about COVID. So it's a real challenge for us to think through how do we get the balance of that right. We're worried about the safety of our young people, and we're more and more concerned around violence against girls and women, and the impact of peer-on-peer abuse and sexual harassment, and what that means. And it's a real challenge for our girls and young women. The Sarah Everard case has had quite hit hard, quite a lot of conversation for our girls about not feeling safe to walk home, not feeling safe to be out at night. What does that look like? A lot of sexual harassment, a lot of everyday sexism, and things that we really need to start talking about and do better on. But we're also worried about our boys and what it means to grow up in a context of toxic masculinity, and how they can be having safe and meaningful conversations as well. We worry about county lines coming into Weymouth and Portland. You know, there's 3 active county lines coming into Weymouth and Portland, and while we do great work on mapping safety and doing other things, we know we need to do better and think about not only harm that's caused within a family environment, but harm that's caused by the community, within a community, and how do we do that together to keep our children safe. We really worry about parent and carers' well-being, and thanks, Hannah Rose, for sharing your story. We see the impact every day of domestic abuse, substance misuse, and mental well-being on our children and young people. And we are keen to think about how we can work in different ways to get that right. So meeting parents where they are and coming alongside with them. We've got too many children either at risk of or experiencing significant harm because of not being able to get it right, and wrapping our services round together to think family. For our parents and carers. So we've got a bit of work that we're planning to do around that. One of our families described the experience of nearly having a full-time job, trying to engage with all the services that are around them. So trying to get the support for domestic abuse, trying to get support for the financial hardship, trying to get an appointment for the doctor or the GP, trying to be able to engage with substance use services that previously hadn't worked. And their diary was really, really full, in addition to trying to get the children up and get them to school. So we want to try and think about how we can do that differently so that we can get that right. And we worry particularly in Weymouth and Portland about physical health and well-being of our parents and carers, because we know there's great inequality, and more of our parents and carers in Weymouth and Portland worry about their physical health and well-being than elsewhere. Affordable, good quality housing is an issue not only for our care leavers, as I spoke about before, but also for our families. Having big enough houses that are of good quality, that are affordable, is a real challenge. One of our young people that we're working with at the moment, long history of being involved with a social worker, when we asked him, what's the thing that you would like the most? And he said, a garden and being able to go out to play. You know, living in a flat and somewhere to go. So that affordable, good quality housing with good access to things that people take for granted is something that we're thinking really hard about. Keeping children safely with their families. So more of our children in care come from Weymouth and Portland than in all the other localities. So 40% of our children in care come from Weymouth and Portland. So we're not getting that right. We are really aspirational that for our children, it's their right to have family life. And first and foremost, that should be with their families and people that they're connected to. So we need to do better there. We need to do better to be able to help and support and understand what's going on for families and how we can create some of those good family connections to keep them together. We're worried about our young people's emotional well-being. We're worried about the impact of the pandemic. We've seen a huge rise in complex eating disorders. Access to those services is really problematic. So our children are worried. They're worrying about climate change. They're worrying about having missed out at school. They're worried about not having seen their friends. So anxiety definitely on the rise, but we're also seeing a rise in some of those more complex issues as well. And the services and the support is not there to be able to meet their needs. So a real national crisis for us, but affecting our children in Weymouth and Portland quite significantly. So we're worried about that. And then we're worried about having enough local homes and foster carers for children who need care. We want our children, when they do come into our care, to be able to stay in Weymouth and Portland. We want them to be able to stay at their school with their friends, with their local communities and people that they know. So we need to do more, I think, to recruit foster carers in particular in Weymouth and Portland. And while we have some programs in place, some of you may have heard of the Harbour model, which is our new model of care and our new children's home, and I can share a little bit more about that. We really need good foster care for our children as well. So those are some of our concerns, some of our worries, and some of the things that we would like to work on together. Amanda, if you want to take us on to the next slide. So we're really keen to make a difference together. Amanda's spoken about local alliance groups, and on the left-hand side, these are the different ways to get involved in those, and Amanda will be able to talk a little bit more in the detail of that if people are interested. But I suppose what I'm more keen to talk about today and start the conversation is about what's already working well that we can build on and share. What's most important to you in your communities, and what can we help with to be able to accelerate or connect or to move up forward to get better. So I think that's us, Amanda, isn't it? Do you want to add anything?
Thanks so much, Claire. Yes, it is us. It's just at the top there where it says answer a challenge question and ways to get involved. This was something that was really beautifully pointed out to me, and I love the concept. So what that means is rather than mapping services or busily looking at community assets in a mapping basis, which is really important and something we do and try and seek to understand, putting out a challenge question to the community, and so asking a question such as, it could be a big question such as, how do we help children in Weymouth and Portland to thrive, and just seeing what comes back. So we're thinking through ways we can send out those challenge questions, and I thought that was a really lovely approach. So that's what that means on the left. But yeah, really keen to work with everyone here and think, the promise of what we can achieve together really is what we're hoping for.